Hi, this is Jessica DaMassa with WTF Health at Health Datapalooza, and joining me right now I have Susannah Fox. She is a health technology entrepreneur and researcher, and also the former CTO of HHS. Susannah, it's a pleasure to meet you and finally get to talk to you.
I'm really glad to be here.
So what are you working on right now? What is this health technology, startup-y, researchy stuff you're doing?
So I'm back in the field with a survey, which is what I did for about 14 years when I was at the Pew Research Center. And this time I'm looking at 14 to 22-year-olds, how they use digital health and social media, especially looking at emotional well-being and peer-to-peer health.
Okay.
My passion is making sure that anytime we're having a conversation about healthcare, technology, a certain group of people, I want to make sure that we have data to inform the conversation.
Okay.
And so that's my focus right now.
All right, so how is your survey working? Like, what are you doing? Tell me a little bit about it.
Well, the great thing about these days and about this demographic, adolescents and young adults, are really mostly online. And so we were able to conduct an online survey. And as a reformed telephone survey person, I now understand, frankly, how disrespectful telephone surveys are.
Okay.
They call you at home when it's convenient for them, not you, and they ask you all these questions, and you have to sort of fit into their box. The great thing about an online survey is that we did ask questions where you had to make a choice, but then we had plenty of opportunity for open-end questions. And I have to tell you that with this age group,
I'm curious about that.
Talking to them about social media and emotional well-being, it's almost as if they've been waiting for us to ask.
Really?
Because the depth of the responses that we got really brought tears to my eyes.
Tell me a little bit. Can you share like some of the insights you've gotten?
I can share broadly that the data is going to come out this summer,
Okay.
and my colleague and I, Vicki Rideout, are analyzing the data now, and what we are finding is that this is the generation that we all really need to look to and learn from, because they're using social media and digital tools in ways that are creative.
Okay.
They understand that they can go online when they're sad and connect to friends. And some of them tell us that if they're feeling sad, they know not to go online because then
They'll just feel worse.
They'll feel worse.
Okay.
They'll see that everybody's at a party without them.
I get that when I see those washboard abs on Instagram.
Right, and so you compare yourself to that. This is also a group of people, these adolescents and young adults, who are using health apps in some pretty interesting and creative ways. So what I would say is that there's so many audiences who are going to find useful data in our report, whether it's entrepreneurs, policymakers, payers. Every sector of the healthcare market is going to find something interesting, and that's really my passion, to shed light on this market so that we can better understand it.
I'm curious to know, like, what kinds of health apps these folks are using. Can you share that? Or I don't want to like steal the thunder of your survey release, but
so it's no mystery.
Okay.
And with this age group, diet and fitness are really the top health topics that they look for information on. That's historically true, and it's also true in our data.
Okay.
And that interest is reflected in the apps that they use. There's also a really interesting trend towards mindfulness apps and an understanding of the importance of sleep. And the other thing that I love is when you just give people the open text box and allow them to share, a lot of women are using period tracking apps.
Okay.
And just to give a throwback to some research that I did prior to this among the adult population, one of my favorite findings was when we asked men and women what kind of apps they use. And there was a small group of men who were using period tracking apps.
Really?
Yes.
Oh, that is surprising.
And I love that when you are doing research and you find that unexpected
little
data
nugget.
point, and it gives you a little window into like, well, let's look at that. Why is that?
Right?
And you can imagine why that would be.
Sure.
And it's just the how might we do research that actually reveals what people want to tell us.
I love your approach to not only how you're collecting the data, but more so how you're actually like really looking. I mean, like you are like enamored with this data. Like to just watch you smile about it is just, it's like infectious over here. So I guess for other folks that are working a lot with data, like how do they have that smile on their face? Like what's your advice to people who work with a ton of data in order to, I guess, fall in love with their data enough where they notice these subtle little nuances?
So for me, and this goes to the work that I've done as a researcher and the work that I did at HHS with the Open Health Data Initiative, is you have to see the stories in the data, whether it's going to be an individual, whether it's going to be, just a small slice. The ability, for example, for Medicare beneficiaries to unlock just their claims data with Blue Button. There's a story there.
Yeah.
You can imagine what they're going to be able to do with that data. And then you look at population level data and the broad trends in the United States. Well, how might we see the broad story of healthcare? And for me, that's what data really can be, as a window into the stories of people's lives.
Tell me what you're excited about looking forward. I mean, I've always focused on what's the future, so what's the future, I guess, or what do you hope the future is going to be in terms of, I guess, data use in a really meaningful way like that to tell a story in healthcare?
So what I have always tried to do is look at the edges of any industry. You look at who are the artists, who are the hackers, who are the people who are pushing the edges, who are the people who are using every tool available to them. In healthcare, that's people living with rare disease, people living with life-changing diagnoses. And so early on, I saw them using data in unexpected ways.
Sure.
What I'm seeing now, the coming trend, is peer-to-peer healthcare.
What does that mean?
So that means that the internet can connect us not only to information and data, but to each other. And that's what can really unlock health and well-being in the United States. That's when we're going to see people being able to share their stories and kind of power up together what they're able to ask for from the system. Because it's not just you alone, it's you with everyone else who's going through that same thing.
That's amazing. Thank you so much, Susannah. It's a pleasure to speak with you. I really appreciate your time.
Thanks for having me.
Thanks so much. This is Jessica DaMassa at Health Datapalooza with Susannah Fox.